I'd like to welcome you back to the show. It's always our pleasure to welcome our friend Paul Seegert. He's with PCSadvisors.com. What they do is manage healthcare for businesses, and they lower the cost. They can dramatically lower the cost of healthcare while increasing the benefit of the plan. It's a different approach with drastic results. Paul, welcome back to the show.
Thank you for having me. How are you today?
I'm doing good. Thank you so much for being with us. So there's interesting things going on. California has got pedal to the metal in terms of a series of bills all having to do with COVID. They don't want to give it up. And then Biden's back there in Washington begging for more COVID dollars, even though I think most people want it to be behind us. And in the meantime, you're reporting that to us that many of the testing providers will no longer provide the test free for uninsured Americans, and that's 31 million. Where's all this going to land?
Well, sometimes I think about these things and I say, well, past performance is the best predictor of future performance. And it's not often that we create a program and don't just keep funding it into eternity. And I expect they will probably pass more rescue dollars and perhaps continue to fund this for some period of time. But to me, it highlights a really serious problem that we have in the way that we pay for healthcare in general in our country, where as a consumer, the American consumer is so powerful, and everybody wants to sell their products in America to our consumers. We can pull up our smartphone and go buy a big screen TV and check all the prices in 30 seconds, but we still don't have that mindset when it comes to healthcare. We just consume healthcare in terms of our copays and deductibles. And service providers and manufacturers know this, and they know that likely insurance is going to be the primary purchaser in this country, and that copays and deductibles will have no actual relation to real cost. So they're just going to pile on and create COVID tests that cost $100+ here that you can get in a drugstore for $3 US in Europe, even though it might be the very same manufacturer. So to me, it's a really great conversation to have, because this situation highlights it, but it's not unique. It's the reason that we overpay for a broad range of services in our system.
So I did a paper on some of this in college 40+ years ago. And the excuse then was, well, America does all the research. And therefore, that's why it's more expensive here, because we're paying back those pharmaceutical companies for the research. Is that still a bogus argument now as it was 40 years ago?
I would say it definitely is. Look at these companies. There's some companies right there in California that are U.S.-based manufacturers selling COVID tests. You can go into a drugstore in Sweden and pick one up for $3, $4, $5 U.S., and they're not selling it here for that amount. But you just have to step back in a common sense way and say, would they sell it over there at a loss? Of course not. So it's a classic case of doing it because you can, and so we overpay. And the consumer doesn't care when they don't have a copay.
Right.
But as soon as that copay, the program ends, and we've got 30 million people without insurance that now probably just won't get tested. And I'm not a big, person, super fearful of COVID or whatever, but it definitely will impact behavior. If you're going to go from $0 to $120, you may not get tested.
Well, especially with the food and fuel prices going up, that'll be the last thing they're going to do. So let me ask you another question here. This is a little bit of a rabbit trail, but Obamacare is still out there. So how do we have 31 million Americans without health insurance?
Well, you have people that really the biggest uptick in enrollment since the Affordable Care Act kicked in was that we marketed Medicaid better, government programs better. that were already in place. So we added far more people to those existing programs than we did to Obamacare exchange plans. And you have a group of people, there's a donut hole, so to speak, where you have the very poor who already qualified for programs and subsidized coverage and even free coverage were getting covered. They're still getting covered. And then you have some folks that are lower income that can qualify today that didn't before. And then you have people that make a good wage and don't qualify for a significant enough subsidy that they feel it's a good choice for them financially to enroll. And that is actually, I would say, rather than a rabbit hole, it is absolutely a part of this same conversation that we're already having with COVID testing. When the government is going to pay for the insurance product, if you're a person going to the exchange to buy a plan and your income is at a place where you get most or all of that premium covered, let's say a lion's share, it feels affordable. If you're not getting subsidy, it's wildly overpriced and the quality is low. By quality, I mean access to providers is reduced. As soon as it came out, over half the providers in California said we're not accepting it, and because the reimbursement rates are low. And so then you are kind of pigeonholed into the providers that are willing to take very low reimbursement, which generally aren't the really good quality providers. And then you're also facing significant out-of-pocket costs. The other advantage for someone that is low enough income is not only is the premium, they get a premium subsidy, but they can get assistance in paying their out-of-pocket costs. So you have a situation where those who don't qualify for subsidy now have to pay for something that really wasn't priced for a consumer to pay. It was priced for a government that would be willing to overpay. And that's the same problem we have with the COVID tests. It's the same problem we have with really just so many things in our system when free market forces are prevented from working.
So I don't know if I quite got that in terms of if people are on Medicare or Medicaid, are they considered uninsured?
Well, they're insured. They're a government.
So how does the 31 million? Because are those people in the middle? Is the 31 people of the people in the middle that you were talking about?
Yeah, a lot of those people are in the middle. Yep.
See, I'll tell you what.
And there's apathy, people that just don't enroll.
Right. Okay.
That's unfortunately is a part of it as well, even though now we have this rescue legislation that was part of COVID that extended until the end of this year the reality that no one would have to pay more than 8.5%, I believe, of their income. So you have subsidies, even where if you're a 60-year-old couple making $215,000 a year, you can still get a pretty significant subsidy. But
wow,
but that's not normally the case. We have some extra subsidy happening now. But then you have to question and say, okay, if past performance is the best predictor of future performance, what are we going to do? Are those subsidies going to get funded again? And that's something we're definitely watching closely, because that when the government pays for the consumer and the consumer doesn't have to see the cost, we get subjected to a lot of waste.
So I'll tell you one of my pet peeves. So my day job is serving as a government watchdog. And I've always emphasized the difference between having an insurance card versus getting medical care. Yeah, so for instance, somebody with a medical card, it may take you 2, 3, 4 months to get into a doctor. So your card meant nothing. But then there's other people that have no card and they go to a county health clinic. I think there's a dozen of them. And they will not turn you away based on your ability to pay. Upwards of 50% of all the babies born in Santa Barbara County are born at taxpayer expense at one of these county OB/GYN clinics. And Paul, what always bothered me is they never did the math on who is uninsured but is still getting treatment, and or why didn't they shut those things down to force people to buy insurance?
Well, yeah. because they're getting, it's a case of sometimes of not-for-profit entrepreneurialism where they get compensated based on seeing people. So do they have the incentives in place to see, are these people insured elsewhere, and should we bill that source of coverage and so on? And it is very common. You have these, not to pick on any, it's not intended to pick on any provider, but you do have federally qualified health centers that folks can go get care. And are we doing a good job of checking on all that stuff? And I'd say probably not that well, no. And so there's another point of leakage in the system. And to your point, having coverage versus having access to care in a timely manner is not at all the same thing. If we applied looking at Canada as a close by example of everyone having coverage, but you don't get access. If you were to apply the wait times they have in Canada to the California population, 700,000 Californians would be waiting a significant period of time for coverage or for care that they need. That could be cancer treatment. It could be a surgery that they need, a joint replacement, which is why 65,000 Canadians a year come down to the U.S., that those that have the means come down and get surgeries here. Because while they have coverage, they're just not willing to wait as long as it takes to get the care. Sometimes
up there it could be a year or two for a lot of stuff, right?
Yeah. Mm-hmm. Yeah.
All right, we're going to take a break. Our guest, Paul Seegert, managing partner, PCS Advisors Employers. Check them out. See if they can save you a boatload of money. And folks, if you don't like your plan, talk to your employer and ask them to call and to contact PCSadvisors.com to see if they can get you a better plan. We're going to be back. You're listening to the Andy Caldwell Show. Stay tuned.
Looking out for labor, agriculture, and business each and every day. It's the Andy Caldwell Show, brought to you by COLA.
I'd like to welcome you back to the show. Our guest is our go-to healthcare expert, Paul Seegert. And he should be your go-to healthcare expert, too, if you own a business. He's a managing partner of PCS Advisors. They help their clients save money by cutting the expense of healthcare while actually increasing the benefits. That is called a win-win. Paul, welcome back to the show.
Thank you.
So this next story is intriguing. It has to do with this poor fellow was visiting his grandfather in some remote part of Wyoming, when in reality, all of Wyoming is remote, in my opinion. Anyway, he gets diagnosed with some really bad stuff, ends up getting air flighted, and the devil's in the details here as far as what went wrong with this procedure. But tell us how he got stuck, or at least initially stuck, with a $489,000 air ambulance ride and another $70,000 for a regular ambulance.
Yeah, which is crazy. It ties to, there's a common theme. It ties into the whole idea that, hey, if insurance is going to pay, why don't we just charge him $500,000 to move this guy around? Why don't we charge him $70,000 to take him from a hospital to an airport and an airport to a hospital on the other end? You wouldn't, if you had to compete in the free market for that service, there's no way that you would charge that and get away with it. I mean, you wouldn't even, service providers wouldn't even have the guts to do that. And yet we see that kind of thing happening in our system. And then as an American consumer, you scratch your head when your health care renews and say, why the heck did it go up again this year? These things are happening inside the plan and you don't see them. That's why. And this case highlights kind of a unique problem that there's some, I think, actually decent work going on to solve, which is surprise billing. There's a couple forms that can take. You can be in an in-network facility. Let's say you're in an in-network hospital, and then you get seen by an out-of-network doctor that's there as a contractor, as an example. and you get this bill later, and you're thinking, what the heck? I was in network at an in-network facility. I thought I paid the bill. Now I'm getting this out-of-network charge for fill in the blank. And you have no idea that the hospital is hiring people as contractors to fill positions, or essentially outsourcing it to a staffing firm to put talent in their hospital. It's cheaper for them, but it's now out of network for you. And
so let me
the
tell
fact
you,
that we let that go on this long is really insane. But that hasn't been going on until very recently.
Let me explain, give you an example of what happened to one of my family members. So, and I don't know, it's probably one of my kids. I don't remember who it was, but so my wife, calls this doc that has done, it's probably like wisdom teeth removal. So he's probably an oral surgeon. She calls this guy, and he's in our network. We've used him 2 or 3 times before.
Yeah.
And they're going to schedule an appointment as soon as possible. Well, this in the Santa Maria office was too busy. So she said, well, can I go to the Arroyo Grande office? And they said, sure. Turns out the same doc, he was in network in one of his offices and out of work network in the other.
Right.
Same doctor, 15 miles away, 2 different offices, 2 different communities. So we found that rude awakening. So one of the questions I had about this is, I can understand how the insurance company would say, is this medically necessary? But what I didn't understand is, you would think that it would be a requirement when they're talking this much money for the medical flight to have gotten the pre-authorization. And to me, if they don't have the pre-authorization, that should be on them.
Well, it is. And they did, but they sent the pre-authorization literally in the wee hours of the morning before the flight was scheduled. Before that, they had told the consumer, you won't be responsible for anything that your insurance doesn't pay, so you're good. And it just highlights, again, the fact that we don't provide consumers good information, generally speaking, to consume health care like they do other things. So the consumer says, okay, I'm fine. I'd prefer to get treated in North Carolina as opposed to Denver. My whole family's in North Carolina, and I have a very serious condition. So, if I'm not going to be responsible for any share of cost, put me on that thing and fly me over there. Well, they sent the pre-authorization, so technically they checked the box of sending it. They didn't send it in enough time that it could get returned. They took them on the flight anyway, because I'm sure they've run the numbers and they figured out enough of these people end up paying them that it's a winning model. And in this story, the insurer sent a check for $70,000 to the insured to forward to the company that did the flight. So, they know how it's going to play out, and they've run all these models on it, and so they get away with it and they do it. In the end, were the press not to have gotten involved, then this poor consumer would have had this on their credit report, and it's just been a devastating thing for them.
See, that was one of my questions. Folks, the media got involved, and that was one of my questions. Had the media not gotten involved, would this poor guy be on the hook for over $500,000 in charges?
Mm-hmm. Yeah, they would chase this person, and they would have the ability legally to even take action and get that money somehow, some way. That's
so
one
in
of the
this
dark stories of the pandemic. You had hospital systems, some of the biggest hospital systems, were suing people that were unemployed and didn't have the ability to pay for bills, even as small as less than $300. And
wow.
The defendant wouldn't show up in court, so boom, they kind of as a default, they would win the case, and then they could garnish wages, and boom, 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 boom. And some of these hospitals that were getting piles of money in the rescue legislation also made piles of money suing the heck out of consumers.
So one other thing in this story is a reference to a law called the No Surprises Act. Could you tell us about that?
Yes. So the intent here, and this is a good thing. We'll see how it gets implemented, because often in the implementation is where these things lose value, like hospital transparency. In the implementation, the fine became $300. $300 is irrelevant to a hospital. $300 a day for non-compliance with that. So I'm watching that closely. How do they implement this, and what kind of teeth are in it? But the intent, at least, is that you're not going to be held responsible when you go to an in-network facility and they don't inform you that you're being treated by an out-of-network provider. They're going to have to take in-network payment, essentially. And if there's a dispute, there's a process set up for that to get resolved. So that is very positive. It applies to situations like this medevac case. And a lot more commonly, it applies to someone showing up and they've got, I took my daughter in for just an odd reaction, an allergic reaction she had as a young child. We were away from home, out of state, took her to the ER. Turned out the doctor was out of network, the facility was in. And it's emergency care, but still, they attempted to bill us out of network for the physician's time. And fortunately, I'm in the business I'm in, so I could walk down the hall and give someone the bill and say, please help me. But the average consumer has no idea. They get a bill, they're scared, they don't want to go to collections, which they could, and have their credit impacted. So they pay this invoice. And that's what this legislation was about, is to put an end to that, because it's unfortunate, but people will exploit these, I don't know if you'd call them loopholes, but these areas that'll allow for bad actors to do these kind of things.
Well, the bottom line here, folks, is anytime you go to an emergency room and you ask them what's this going to cost you, they're going to say, well, we don't know what's wrong with you. We don't know what tests are going to run. We're going to know what procedures. We don't know if we're going to have to rush you to an operating room, or we don't know. And so, it's, like in automobile repairs, you've got to sign an upfront estimate of the cost of diagnosis, the cost of the repairs, the cost of the parts, et cetera, et cetera. I've never heard of any hospital doing that anytime. In fact, even when you leave, they don't tell you what your bill is.
No, they certainly don't. They look at you as if you're asking a crazy question. If you ask them, what's this going to cost? And they also ask you to sign your life away when you're checking in, that you're giving them permission to bill your insurance, and you're taking responsibility for anything your insurance doesn't cover, in real basic terms. That's very significant, and really unknown to the consumer. You could add some simple language to that, saying, I will accept it up to this certain point, as an example. Now, they would be completely confused as to why, you're going to be 1 in a million doing it, but you could do that. And
do they have to take you?
And they would all, and yes, especially if it's an emergency, they absolutely do. And you would limit your liability in doing so.
Wow, we need to talk more about that when we have more time.
We absolutely
Paul, you're a wealth
share some language that you can share with people that they could just simply drop into that agreement.
And now, of course, a lot of this stuff now you sign on a pad. Mm-hmm. We need to have you explain that next time you come on.
Let's talk about it. Yep, it's important.
All right. And I'm going to I hope to send you some bills. They're trying to penalize, there's some bills in California here trying to penalize doctors for how they advise their patients and things like that, especially through COVID, and or for spreading misinformation about COVID. It's crazy what's going on out here. Paul, thank you for being with us.
Thanks for having me.
All right, Paul Seegert, PCSadvisors.com. We'll be back. You're listening to the Andy Caldwell Show.